Now, Nandini, what top story have you got for us today?
My story is a tragic one which reveals some serious issues in China. A doctor was brutally stabbed to death by a patient's relative at a Beijing hospital. The victim, Yang Wen, worked at Beijing Civil Aviation General Hospital's emergency ward. She was pronounced dead early Wednesday, hours after being attacked. The alleged attacker, whose mother was being treated at the hospital, has been charged with murder.
Well, that sounds horrible. What happened exactly?
Well, the attacker's mother had been in the hospital since December 4th. The family grew upset by the hospital's inadequate treatment of the 95-year-old. After the mother's health didn't improve, they blamed Dr. Yang. It's thought that the family grew even more upset after the doctor informed them that the mother not only had an infection, but was also suffering from heart failure. Caixin has learned that Dr. Yang told hospital administrators that the family threatened her. Video footage then shows Dr. Yang being stabbed by a knife-wielding attacker who appears to be the sick mother's son.
Well, that is absolutely horrific. But why have you chosen to put this story on our business and economics podcast?
Well, the incident has ignited a lot of debate as to how China's hospitals are run and the business of healthcare. A major point of dispute between the family and the hospital was that the family had demanded that the mother be transferred to an inpatient ward. However, this request was denied because the hospital said the inpatient ward lacked the emergency equipment necessary to treat the patient. This highlights a real problem of the country's healthcare system. China has an aging population with increased chronic healthcare issues. Whether hospitals have the resources to meet the population's needs is a massive issue. Also, and this might be even more important, is how hospitals are evaluated and funded. A source familiar with the country's medical policy told Caixin that Chinese hospitals sometimes try to avoid admitting elderly people to inpatient wards since they are at greater risk of dying. Under China's current hospital evaluation system, medical institutions can be punished for having high inpatient death rates. Lastly, the story exposes problems with China's medical insurance system, which covers the vast majority of the population. The insurance system pays for some treatments, but not all. The family had accused the hospital of deliberately saddling them with debt because the medical charges for emergency treatments are not covered under China's medical insurance system.
So, what has been the end result?
Well, the government recognizes there's a problem, and on December 28th, China's legislature passed a law that aims to prevent violence against healthcare workers, which is all too common. This is set to take effect on June the 1st. And, quote, bans any organization or individual from threatening or harming the personal safety or dignity of a medical worker. And the country has been reforming its healthcare insurance policy for a number of years. However, at this point, it remains uncertain if the state plans to amend the country's hospital evaluation system.
Okay, well, we've done a number of stories just in the last week on how China is reforming its healthcare system, so I'm sure this will be a subject we'll be returning to.